artificial insemination of the dog, we can use fresh semen or preserved semen, which is either chilled or frozen. We use fresh semen when there's difficulty to mate, temporary physical disorders, to prevent diseases, and when there's a lower sperm quality. And we used preserved semen for geographical distances and for semen banks. For the timing of insemination, the max bitch fertility is at ovulation, so 2 days after the LH peak. And this lasts until day 7, and then it decreases due to cervical closure. The total fertility is a few days before the LH surge until 7 days after ovulation. Canine sperm can survive 11 days in utero. Fresh semen can be given from ovulation to day 6 or 7. And you should have 2 artificial inseminations at a 24-hour interval. Frozen semen should be given from day 5 to day 6 after the LH peak. This is when the P4 is greater than 2 ng per L. And there should be 2 artificial inseminations at a 24-hour interval. For the success rates, fresh semen is best. This is around a 60 to 90% success rate. Chilled is less, at around a 50% success rate, and frozen is worse. It can be as low as 20% up to 60%. Depending on the size of the dog, the sperm can range from 300 million to 2 billion sperm. In fresh or chilled semen, all the sperm should be motile, but in frozen semen, at least 100 to 200 multiplied by 10 to the power 6 sperm should be motile. The techniques for artificial insemination are intravaginal, intrauterine using an endoscope, or intrauterine using the Norwegian method, which is a specialized metal catheter. The intravaginal method is the only method where you can't use frozen semen. You use a Foley catheter, which is a special artificial insemination catheter. You insert as deep as possible and you inject the sperm. Hold the bitch by the hind limbs elevated at 45-degree angles for 15 to 20 minutes. This is to allow gravity to help. Insert a gloved finger to stimulate contractions towards the cervix. In the intrauterine endoscopic method, use a rigid endoscope with a special port. It's non-invasive, there's no sedation, and there's no anesthesia. Insert the shunt catheter and inflate a balloon with saline. Then introduce the endoscope in the catheter and search for the cervix. Then attach the insemination catheter in the endoscope port and go through the cervix gently. Then inject the sperm with the syringe and wash with saline. The next intrauterine method, using the Norwegian method, you use a specialized metal catheter in a protective sheath. The cervix is localized by abdominal palpation. So first you insert the catheter with the sheath, then you go through the cervix and you remove the sheath and you inject the sperm. For the surgical method, when you do a laparotomy under general anesthesia, you exteriorize the uterus. It's invasive and it's not repeatable, and it may not be ethical. It's only really done for really good and rare semen.